Before taking blood, you'll need to assemble your equipment. We will demonstrate the Venepuncture system, which is used in many trusts. The Venepuncture system involves a needle that fits into a plastic collection system. By unscrewing the back of the needle, you can then attach the needle into the collection system. This gives a secure way to collect blood that minimises any sharps injury. The blood bottles, which have a vacuum inside, enter the bottom of the Venepuncture system, and firmly pressing them in will release the vacuum and allow them to fill with blood. Using this system, you can then fill a number of different bottles. I will also need an alcohol swab, some tape, gauze, tourniquet, and a pathology request form which may look something like this. Place the tourniquet about 4 to 5 centimeters above the site of venipuncture, warning the patient that it will feel tight. It is often helpful to have your patient's arm resting on a pillow. To encourage the veins to fill, ask your patient to open and close their fist. Rubbing or gently tapping the vein can also help. Clean the venipuncture site with an alcohol swab and allow it 30 seconds to dry. Once the venipuncture site is dry, expose your needle and aim the bevel pointing upwards to allow it to fill with blood when it enters the vein. Hold the needle firmly with your thumb and index finger, and you can use your other fingers to stabilize the needle as you advance it into the vein. Warn the patient of a sharp scratch and advance the needle into the vein whilst keeping it as stable as possible. You can see a flashback at the proximal end of the needle, indicating we're in the vein. Without moving your hand, you can insert the blood bottle into the collection set to fill it with blood. Further blood samples can then be taken as required. When no further bottles are required, you can remove the tourniquet and apply pressure to the site with some gauze, whilst withdrawing the needle. The needle must go straight into the sharps bin to minimise the chance of any sharps injury. You can ask the patient to raise their arm whilst applying pressure to the venipuncture site to minimise any bruising. You can then ask the patient to place their thumb over the site whilst you get some tape to tape down the dressing. Once you have taken the blood, it's important to label the bottles, and it's best practice to do this at the patient's bedside. This would include name, hospital number, date of birth, ward, date and time. You will also need to complete a pathology request form, which may look something like this, including which test you are requesting, patient's details, and clinical indication for why you are doing the blood tests, and date and time. Finally, make sure you sign the request form. For full blood count, most trusts use a purple bottle. Most biochemistry tests, you use a yellow top. For clotting and INR, a light blue top. For group and save and cross-match, a pink bottle like this. And for glucose, a grey top.